According to the most recent census data, Hispanics constitute approximately 6% of Michigan's total population. Hello and thanks for joining us. I'm Laurel Hess and this is Comcast Newsmakers. Joining me now is the president of the Lansing Latino Health Alliance, Dr. George Mansour. Thank you so much for joining us.
Thank you for inviting me.
6% may be a Michigan number, but here in Lansing that number much higher, closer to 13%.
Closer to 13%, exactly.
Which is why an organization like yours is so needed, so necessary, and so helpful.
The Lansing Latino Health Alliance is trying to do exactly what you say, to be helpful to the community at large. The organization was founded in 2003 as an advocacy group whose purpose was principally to work towards equality of access to healthcare service and insurance. The primary mission of the organization is to raise the health status of Lansing Latinos. And we have worked since then with that in mind.
What are some of the unique challenges, maybe situations that specifically the Latino population faces when it comes to healthcare, access to healthcare, that other populations may not see?
Okay, healthcare is not necessarily given out, provided on an equal basis. We wish that that were the world in which we lived. It's much better than what it was. But many of the Latinos have required assistance in accessing the insurance as well as the healthcare system. This has been a major challenge, and one of the things that the Alliance has done is to provide policymakers, decision makers, with the data sufficient to have them enact new legislation. And this has been done over the course of the last 10 years.
What changes have you seen since you've been working with the Latino population for 10, 11 years? Have you seen the situation improve?
Absolutely. In the local hospitals, for example, a monolingual speaker of Spanish walks in and can be attended by bilingual personnel. There's signage in the hospital that points and directs the patient to the necessary sites. Somebody who comes in with no knowledge of English, each hospital has access on staff to bilingual personnel, bilingual physicians, or they subscribe to an interpretation service which is available by telephone or by Skype, so that within a brief period of time there is a voice that can be heard and understood.
How is Michigan doing, or maybe mid-Michigan being your expertise, compared to other states or nationwide when it comes to helping to serve the Latino community get that access to health care?
Well, a lot has been done to improve the situation. We still lag behind some of the states in which the Latino population is considerably higher, and this is to be expected. But we are still working towards that goal. And we want to envision the day in which Latinos are indeed good consumers of health services, and we want to see that day in which Hispanic youths enter the healthcare profession.
That will be extremely helpful when you have Hispanic professionals helping in their own community, certainly in the meantime, helping to bridge the gap, your organization. Thank you so much for joining us today. For more information on today's topic, you can visit lansinglatinohealth.org or you can call 517-999-4035. Today's Comcast Newsmaker was the president of the Lansing Latino Health Alliance, Dr. George Mansour.